I'm Shannon Exum, co-founder of Team COVID Long Haulers. Find out how my family survived a near tragedy caused by COVID, how we're handling the ups and downs, and how we're learning to thrive in new ways with long COVID. Be sure to visit our website at teamcovidlonghaulers.org. In this episode, Travis and I talk about the foundation, our pig Tony, and Travis' first bout with COVID. Thank you so much for joining us. Thinking to myself, why did we want so badly to help others? And I know my answer. You know, you persevere, and if you can make somebody else's journey a little bit easier, you know, having to not go through the exact same things that you did, awesome. It wasn't for nothing that we went through the hell that we did. It wasn't for nothing. If we could now speak up and help somebody else, I feel like it would have been tragic when we were saying, should we start it, should we not start it? I think it would have been tragic not to, because look at the healing that just you, I would never have told this story out loud. So that's why I'm here to encourage caregivers and post-COVID patients to find something that jazzes you up, that gets you jazzed, and go for it. What do you want to say about the foundation on this show?
Well, first of all, if you go take a look at our website, teamcovidlonghaulers.org, and I'm saying that offhand because it would take me a long time to explain what has gone into it. So if you look at our website, it tells you, my story. It talks about Tony, but essentially what we decided when we talked about starting a nonprofit is, I'm a nurse. I love being a nurse. I absolutely love caring for people who are sick. I love the education part, and I wasn't able to do it. And and as you said, there was no telling when I was going to be able to get to that point to do it again. And so my situation being a little unique in the sense that I was a nurse, had been taking care of people who were dying from COVID. Then I was hospitalized, very sick myself. As you just talked about, our struggles with just navigating the system. We wanted to help, whatever that means for other people. We wanted to help, and I don't want our foundation to be about me, because it's not. But I also understand my story is a compelling story, and it gets people to look at our foundation. But it's not about me. It's about helping others, and that's what. Essentially that's what our goal was. If you look at our mission statement, it's to provide support, bring awareness.
Tony came home 10 days old. June 18th, he came home. And by June 30th, Tony had his own TikTok account. Now, this TikTok account, my students at school talked me into it, because I didn't know what TikTok was. I knew what it was, but I didn't do any social media, not even I did nothing, because I just, whatever, I don't have time for social media. But I thought, well, this might be fun. This might be something fun. And, I'm at home a lot now because Travis is home and it's quarantined. Like, we can't go anywhere. Why don't I just do this fun thing and see where it goes, just for funsies? And here we are. It is now February, and he's got 18.3 thousand followers. So just in that little bit of time, and love it. He's got so many great friends. So that's Tony.
And our goal is to get to the point where we can help finance the science and research behind all this. And that's essentially how it got started.
And also near and dear to my heart is the sum of money that we have saved up and are saving up for college students of parents or guardians with suffering from post-COVID. This all happened to you when Noah was getting ready to start college. I'm like, what the heck? We were so fortunate to have a GoFundMe. And you started the GoFundMe. You had the wherewithal to do that, as sick as you were, because I wasn't thinking about it.
Well, we did financially, we were okay, but
we wouldn't have been if it wasn't for the GoFundMe.
I'm just saying, you talked about earlier that we grew up poor, and a lot of the things that we had to sacrifice was no big deal, because that's how we kind of grew up anyways. But And so I just had a COVID moment. I totally forgot
okay.
what I was saying.
No bigs.
I totally forgot what we're talking about.
We are talking about us being less fortunate than others. And
Oh, and the GoFundMe. So yeah,
Yeah.
I mean, that's called swallowing your pride. Have to ask for other people for help. That's what that was. But we need help. And I think the GoFundMe platform is very, very good because it doesn't force anybody to do anything. It's not out there. I mean, it is a public platform, but it reaches anybody across the world to help. And we just told my story and where we were at, and people responded. A lot of people don't have no idea who they are, and that helped. I mean, having that money to help pay for mortgage a few months.
Yeah, it was a mortgage. Yeah,
and
that was our mortgage.
just so we don't have to worry about things such as, gosh, we don't have money to pay our mortgage
and to eat,
and
sure. And some people weren't so lucky. Some people really struggled financially.
Well, yeah, and like I said earlier, I mean, the fact that workers' comp has paid every penny of my medical bills. I mean, again, there are so many stories about this that I just think that you don't really think about until you're in a situation. And one of them is, even if you are very sick, get hospitalized, you make it through and you recover. But just imagine, having to stay in the hospital for a week. Well, that can financially damage and ruin people. And I think that's just some of the things that I think just the average person don't think about. We didn't think about it. And so the fact that every penny of my care has been paid for since day one is, it's very rare. Our doctor I see now has told me he hasn't seen nobody else that's on workers' comp because of COVID, because you can't prove that you caught it on your workplace. But I clearly did, because that's what I was doing. And so we're just very fortunate. I don't know how to say it really. And I think that's just some of the things that I think just the average person don't think about. We didn't think about it. And so the fact that every penny of my care has been paid for since day one is, it's very rare. Our doctor I see now has told me he hasn't seen nobody else that's on workers' comp because of COVID, because you can't prove that you caught it on your workplace. But I clearly did, because that's what I was doing. And so we're just very fortunate.
We didn't talk about the psychological part. And we can't leave without saying something about the psychological part, the PTSD. You want to talk a little bit about?
Well, early on when I saw my doctor, when I got home, again, I don't remember a whole lot of those specifics, but there are hundreds of thousands of people dying, and they start sharing their fears, and their family can't come to see them.
Yeah. You have one particular patient that you told me a little bit about, sports fan.
Yeah, that's my thing, and honestly, that's part of my nursing practices. I like to. It's kind of how I it's kind of an icebreaker with patients. If I go in the room and I got some guy watching football, it's an easy way to kind of introduce yourself and start establishing a relationship. So yeah, I had multiple people like that, but I did have. I did have one particular gentleman. He was an older gentleman. He was in his 70s, and he was very sick. He was a very sick guy. And yeah, he was a huge college football guy. And again, we live in Tennessee. That's the Southeastern Conference for football wise. He's out west, and that's the Big 12 and the Big 10. But he knew his stuff, and I knew my stuff, and it was just a good way to us to build a relationship. And I took care of him for several days, and it's hard when somebody like that dies, and it's just clean the bed, time for the next person. And I think that's what anybody who does this, whether it's a nurse or it's a therapist, the doctors, this is not normal.
Right.
It's not normal to have to put those feelings aside because the next person is potentially dying and they need your help. And so I think the bigger story amongst hundreds of stories with this whole thing is a mental and emotional toll. I just can't imagine
It's, that long.
the nurses who have been doing this from the beginning. I mean, can't imagine, because the people that you see, that you celebrate the ones that make it and they get to go home. Then you got your ones that don't, and again, those that are tough, because again, it's just, I don't like to say they're a number, but I mean, when you've got thousands of people waiting for somebody to help take care of them, you just don't have time to. We're human beings. You try to kind of keep it professional, and you don't want to have your emotions get involved with it, and particularly in a situation like this, because a lot of your patients are dying. And I think that's one thing I like to tell about my story and just the other nurses is this is not normal, and we see death. That's part of what we're taught in school. We're taught a lot of psychology, how to deal with it, how to grieve with families. But I had 9 people die.
And with that, let's take a break.
No, let's just keep going.
Let's take a break.
I want to take a break. Unless you do.
I need to get something to clean our faces with, and then we'll start again. Are you okay?
Mm-hmm.
Thank you so much for watching. Join us for episode 2 as Travis talks about his heart-wrenching recollection of the hospitalization.